Hi, this is Jonathan Ginsberg. I'm a Social Security disability attorney. And I want to talk to you today about 3 genetic diseases that are often interrelated, often are diagnosed in the same person, perhaps because of the same genetic issues that cause them. And these are Ehlers Danlos syndrome, Chiari malformation, as well as POTS. And that is, make sure I say this correctly, posterior orthostatic tachycardia syndrome. And basically all these symptoms, all these issues, again, are genetic. Ehlers Danlos, if you've got it, you know what it is. Obviously, it is a situation where you have hypermobility of the joints, resulting in easy dislocation of the joints. Frequently, it can be the shoulders, the knees, even the fingers. Also, the skin is very flexible and sometimes susceptible to tears. And it's often accompanied by the Chiari malformation, which is where part of the brain tissue protrudes into the spinal canal, and that can cause severe headaches, very disabling if it's severe, causing headaches, and many times requires a surgery and a cervical fusion to address it, although it doesn't always solve all the problems, but it does increase stability. And the POTS, so the posterior orthostatic tachycardia syndrome, which is where the autonomic nerve system does not function correctly. And I've had cases where a client would, for example, be standing up, and the heart would not get the message from the nerves in the legs, I'm standing up, and would not pump blood to the brain, and the person would literally pass out. It could also, I've also had cases where my client has reduced gag reflex, and what that means is, in practical terms, is that when this person is eating or drinking, they have to do it very, very slowly, otherwise they're at risk of choking, and it just causes a lot of issues with the, again, autonomic or involuntary nerve system. And obviously or not so obviously, I guess, but with these conditions, they can exist at different levels of severity. Obviously, if it's very, very severe, for example, with the Ehlers Danlos, if a person is dislocating their elbow or their shoulder or their knees on a regular basis several times a week, that's very, very painful. Sometimes it requires a trip to the hospital. That is more disabling than a situation where a person may have it happen once every 2 or 3 months. Same with the Chiari malformation. Again, there is a surgery that's sometimes done to stabilize the spine that can sometimes get rid of the headaches. Again, it does still mean the person has to be careful, because a bad fall or a simple car accident can cause terrible consequences, but in terms of a day-to-day work environment, doesn't necessarily prevent that if the person's in a very stable, non-contact type of situation at work. But again, many times it can be more severe than that. Of course, with the POTS, at a minimum, it means the person would likely not be able to do a job where they have to bend over, pick something up, but it could also be a situation where they pass out. And obviously, that's going to eliminate jobs that are going to require any sort of working on unprotected heights or on hazardous equipment, driving, things like that. So these are all conditions that can create reliability issues, and I think that's the main thing that I focus on. There's no listing for these conditions. There should be, I think, but there is no listing in the Social Security Blue Book, so generally that means we have to focus on functional capacity as the theory of disability. We can also sometimes use the grid rules, although my experience has been that many of my clients with Ehlers Danlos and POTS and Chiari malformation are younger, sometimes in their 20s, because this is a condition that over time gets worse and worse. So many times when someone decides to pursue disability, they may be in their 20s or 30s or early 40s. So a lot of times the grid rules do not apply. Most of the time we're dealing with a functional capacity argument. And basically what we're saying is that my client would not be a reliable employee because of the need to take time off, again, with a dislocated elbow or shoulder, the person would have to, many times you're trained to put your joint back into place. Again, it's a very painful situation. It may require somebody's help to do that. That's not something you would necessarily see in a work environment. There's also frequently a person would have trouble with lifting, carrying, pushing, and pulling because, again, the joints are hyper mobile. There could be micro tears in the tissue. Remember, the tissue can be very weak. That can cause a great deal of pain. These are all things that would result in unscheduled breaks or missed time from work. And many times we would get from the specialist, from the doctor, a functional capacity form that really addresses these reliability problems. This individual, this patient, would likely miss, let's say, 2 or 3 hours a day because of, on average, because of the issues with the hypermobility. This person would likely miss 3 or 4 days of work a month because of symptoms that could be very, very bad. Again, I've had clients literally that tell me that they're typing or they're writing and their fingers become dislocated or very, very sore. So again, it can impact performance of jobs, but I'm really focused mostly on reliability issues. And with a good functional capacity form from a treating doctor, most judges, once they understand what this condition is, a lot of times we also have in the medical record genetic testing to show that this is in fact the person has the genetic disorder, the genetic profile that confirms this. So there is objective testing in that regard, which obviously helps in a disability case. But I think it really boils down to reliability. So if you're afflicted with one of these conditions or all of them, what I would focus on are the reliability factors, how much time you'd miss from work, how much time you'd be off task from your job duties, how many days of work you'd likely miss at work, in addition to the problems with performance, again, the lifting, carrying, bending, stooping, crouching, kneeling, that sort of thing, or working around hazardous equipment. When you put it all together, we can generally make a pretty fair argument that a person with these conditions, these genetic conditions, would have a really, really difficult time working. And again, a lot of times the folks that I represent are high achieving, they've gone to school, they really want to work, and I think that's also something you want to emphasize to the judge. But the big picture is focus on reliability. I've represented a number of clients with Ehlers Danlos and POTS and the Chiari malformation. We've had pretty good results, pretty much won every one of them, because again, I think once the judge understands what's going on, and sometimes it means we've got to provide the judge some information to explain what these conditions are, it's pretty obvious that they are disabling in the sense that they would preclude competitive work. If you've got one of these conditions, you want to talk about it, please reach out to me. Happy to talk to you. Otherwise, I hope you did find this video helpful. If you did, please give it a thumbs up on YouTube and like it on Facebook. Subscribe to our channel, like our Facebook page, and visit our website at ssdanswers.com. I've got a free secret swing disability survival kit there, as well as a place to ask for a case evaluation. So for now, this is Jonathan Ginsberg, and I do wish you the best. Thanks a lot.